I think the course is unique because it provides a combination of both clinical skills and a sort of more in-depth approach to the research evidence base. So not only the way that we conduct psychological therapies, but a way to think critically and reflexively about how the application of psychological therapies could be improved in the future, maybe beyond the current IAP system. I think it also really helps that we have a lot of very experienced external lecturers, professionals coming in to talk to the students about the work that they do, which gives them a chance to learn from some of the foremost experts in that field in the UK.
To study at Queen Mary University of London means to study at a university that is among the top 1% in the world. We're a member of the Russell Group, and the School for Medicine and Dentistry is among the best medical schools in the UK. We have over 1,000 postgraduate students. The Centre for Psychiatry is ranked 5th for research in the UK, and here simply academic excellence is taught by leading professionals in the field of mental health.
So since the publication of the Layard report in 2009, this was a report that recommended the increased rollout of CBT and other psychological therapies across the UK for both inpatient and outpatient settings. There's a need for a new team of clinicians and clinician researchers who feel confident in using the evidence about psychological therapies and also able to apply their skills in clinical practice. And the psychological therapist pathways is about preparing people for that role, to give them a little bit of clinical skills, but also a better understanding of the evidence and how we approach gathering the evidence for psychological therapies.
This course is ideal really for 3 groups of people. Those who are looking to gain access to clinical psychology or psychotherapy training in the future, those who already work in mental health care and wish to enhance their career prospects by demonstrating advanced competence in psychological therapies, and those who wish to pursue a career in research in mental health or psychological therapies. This course can be taken full-time, meaning that the MSc is completed in 1 year. It can also be taken part-time within 2 years. Exiting earlier after the first module means exiting with a PG certificate, PG cert. Exiting after 2 modules means exiting with a postgraduate diploma, and completing all 3 leads to the whole MSc in mental health. We also offer the course both as on-site and distance learning. And distance learning students, basically, it's perfectly equivalent. The only difference is that distance learners watch pre-recorded videos on an online platform and meet for a live group tutorial once a week with their tutor and all other distance learners.
So over the 3 modules of the course, they start by learning about the assessment of common mental health problems and how to link that assessment to formulation and onward treatment. They'll learn about the range of psychological therapies that are available in the UK and the evidence base for those and how the evidence base needs to be further developed. And then finally, in the last module, they'll get a chance to conduct their own research project. They'll learn advanced research skills and have the chance to write a dissertation, which will be usually an evidence review of a particular area of psychological therapies that they find interesting. Well, because of the broad applicability of psychological therapy skills across the UK at the moment, people who complete the course have a chance to involve themselves in most areas of mental health. It could be to train as an increasing access to psychological therapy as an IAP therapist. It could be to go on to a doctorate in clinical psychology, or it could be to train in another area of psychology, such as health psychology, forensic psychology, and so forth. People who are interested in social work may also find that this is a useful qualification for them to have. And finally, if people are interested in pursuing a research career in mental health, then this will give them the skills to go on and do that too. So between the first and second modules of the course, the students will have a chance to do a placement with a psychological or other mental health service in the NHS or a private provider.
This is a very popular course. Across all our programs, we have students applying and enrolling from all over the world. North and South America, Africa, Asia, all European countries. And this really makes for a very diverse and interesting group of students, and students learn a lot from each other as well on this course.